You're not a good surgeon if you can do a good surgery. You are a good surgeon if you can manage a complication well.
Sir, what was the moment you thought you wanted to become a doctor?
My father wanted me to become a doctor to serve the society. That somewhere kind of stayed with me.
Sir, what were the early challenges you faced during your residency?
So it was more of an opportunity than a challenge.
What belief system you have developed to treat patients' life and to live your life effectively?
In that 2 months period that I was there in the UK, I learned how to deal with the patients. So I learned the art of practicing medicine in the UK, and I learned the science of practicing medicine in India.
What were the problem you were trying to solve when you wrote your book, which is Patients as Partners?
Yeah, so see, the patients as partners is my effort, and this book is directed towards the fellow ophthalmologists, or for that matter, any person in practice. So it's basically for the doctors.
Sir, where do you see ophthalmology or healthcare is evolving within next 5 to 10 years, combining with AI?
So ophthalmology, especially in India, is growing great guns.
In today's episode of Panel Spotlight, we sit down with Dr. Vinay Garodia, senior eye surgeon, founder of Synergy Eye Care, EMS Daily Gold Medalist with 30 plus years of experience and 10,000 plus eye surgeries to his name.
Sir, we started this panels. We have just one purpose in mind. That is, India, most of it's borrowed from Western thinking, Western philosophy. What I want is, I want to inspire original thinking among our new generation of thinkers, new generation of doers. And the best way to do it, sir, is to tell stories who are contributing to their fields. So, sir, this episode with you, I want to make it for younger generation of ophthalmologists. So, sir, first of all, thank you so much for accepting my invitation to be on this show. Before, sir, I start podcast, I want to delve into your journey. Sir, what was the moment which shaped you and you thought you wanted to become a doctor?
Okay, first of all, thanks for calling me to the show. And before we start our podcast, let me see. Our Indian tradition has always been about stories. You know, none of us have read Mahabharata or Ramayana, but we all know the stories. And the things have been traveling for thousands of years through the stories for us. So I think stories are the best way to go about it. My story is not very interesting though, but let me anyway tell you what it is. So I was basically born in Banaras and born in a business family. Was good at studies. So the standard होता है कि पढ़ाई में अच्छे हो तो they take you कि तो science ले ले. I was interested in engineering. I was very good at maths, physics and all that. So I was actually preparing for engineering. I had physics, chemistry, bio, maths, all the 4 subjects in my 11th, 12th. But till 11th, I was preparing for engineering. Now, so happens that my father visited Tata Memorial Hospital to visit someone. He was a businessman. And when he came back, and this is around the summer vacations time between 11th and 12th, and he comes back and tells me, you know, Vinay, medicine is a very noble profession, तो यार डॉक्टर बन जा. एंड उस समय यार हम बाप की बात सुनते थे, सो चलो ठीक है बन जाते हैं. सो आई मीन दिस इज़ अ वेरी बोरिंग स्टोरी इन अ वे यू कैन से, बट आई वॉज गोइंग टू बिकम एन इंजीनियर, but because my father felt that it was a very noble profession, and so he encouraged me to go towards medicine side. So that's how I decided. So after, in that 1 year period, I started preparing for my entrance exams for medicine. I left engineering preparation and started medicine preparation, and that's how I decided to become a doctor. But somewhere I think the concept for which my father wanted me to become a doctor to serve the society, that somewhere kind of stayed with me. For me, of course, coming from a business family, earning money was always important, but that was not the primary motivation because I left that business option and came to medicine. So for me, of course, पैसे तो कमाने ही हैं, but you know the main thing was to do something which is different and in some way to serve the society also. So that's what came in for me.
So, sir, you choose medicine. Sir, what was the turning moment you choose, like you want to enter ophthalmology field?
I think somewhere ना जो मेरा technical the knowledge and the technical interest that was there for which I was going to become an engineer, that came into play because what I saw at that time that ophthalmology was something which was expanding very well. It was a surgical field with a medical option both, and it was developing very fast. There's a lot of technologies coming in. I think that is one thing that excited me to go towards that and the micro precision of ophthalmology. So I think that's what excited me to come towards ophthalmology. I was actually thinking between pediatrics and ophthalmology as the two options. Pediatrics because of the stupid reasons that I like children, but then somewhere I thought, okay, that's not good enough reason for me to go in there. And somewhere I thought maybe I may not be able to see those suffering children so much. So ophthalmology was the next option for me. So between the two, I decided to go for ophthalmology. And I've actually seen the ophthalmology explode from that time onwards. I think lots of changes, especially in my specialty of retina, we could see a lot of changes happening. So it was a very, very good decision in the long run to come into ophthalmology for me.
So when you were doing residency, so what were the early challenges you faced during your residency in ophthalmology?
So it was more of an opportunity than a challenge. Because when I was doing my senior residency, I was in AIMS RP Center. So when we joined in the retina unit, at that time, the machines were very, very basic. And, we used to spend 2 hours repairing the machine and half an hour doing the surgery. That was the time when you have a vitrectomy case, you will do that way. The new machines just came in at that time when we were senior residents, when we had just joined senior residency. So we and our professors were learning the new techniques simultaneously. And we being younger, we had an advantage of picking up the technology much faster. So we have seen it evolve. So therefore, we are very comfortable with the newer machines. Plus, we also had the background of knowing how the machines are working. We had the background of knowing how to deal with the machines which were not working also, because before that, the technology were not that great. So that gave me a lot of inputs into seeing how the things work and how best to adapt to the new systems. So it was a blessing in disguise for me that I was learning retina at a time when retina was exploding. So we could know from the base up how the things are working. So therefore, even now, if I'm operating and machines are machines, in case something goes wrong, I know how the things work and how can I take care of that part. So that is one skill that I have, which unfortunately I see the newer people who are working straight away from the best machines, they haven't learned that part. So I think I even tell them that you have to start with the basics. You should know what the machine is doing before you blindly follow the machine. So that has been the benefit for me.
Sir, after all these years in medicine, so what belief system you have developed to treat patients' life and to live your life effectively?
So one thing that I really, in my journey, I did my training at AIMS, did my MBBS, my post-graduation senior residency from AIMS RP Center. I went to UK only for a brief while, for 2 months only. So there I did not learn ophthalmology because the kind of training I had at AIMS was much better than what anyone else can teach anywhere in the world. But in that 2 months period that I was there in the UK, I learned how to deal with the patients, how to make patient comfortable when they come to you, how to crack a small joke with the patient so that he gets comfortable with you, how to educate and involve the patient in their healthcare, which unfortunately at AIMS, no one was teaching you that. And because we were in a government setup, there's a pressure of work. So often these are small things that we tend to overlook. So I learned the art of practicing medicine in the UK. And I learned the science of practicing medicine in India. So that is one thing that I got from there. And ever since I started my practice in 2001, this is one thing very important for me, that to involve the patient in their own healthcare, not to treat them just like that, okay, you do this. It has to be more of a two-way process. You educate them, involve them into their eye care. Because what I feel is that if I'm, say, treating you, I tell you, okay, Satyam, tere ko ye karna hai, without explaining why, you will follow those instructions for some time and after that you'll tend to ignore it, right? Because you don't know why it is important. But if I explain to you that what I am doing and why I am doing it, then you know the logic behind it. Then the chances of you following that instruction is much more. So I like to educate my patients into their healthcare. I like to give them minimum of restrictions. So I very strongly believe if you tell them 10 things not to do, they will follow 8, they will leave out 2. And chances are those 2 they leave out are the more critical ones, right? So I will tell you only 2 which are most critical to follow. I don't want to give unnecessary restrictions to my patients. So often the patients, my common question when the patient comes for follow-up is, kya parhej kar rahe ho aap? And then they'll tell you these parhej, then I tell them, ye to kuch bhi nahi karna. So I have a very minimal list of restrictions after the surgery or anything. And whatever I tell them with the reason. So give them less restrictions, but explain them why. For example, in COVID, like what we saw in COVID is that people were given so many restrictions. They were following everything. They were washing their hands. They were spraying disinfectant all over the place. But what they were not doing was they were not covering their mouth and nose properly. That was the only thing that they had to do. But they were following the other unnecessary instructions and they were forgetting the more important ones. So if you give them too many restrictions, they don't follow the more important ones because that's the more difficult one, right? So give them less and explain to them. So I like to educate my patients, get them involved in the healthcare. So that has been my philosophy from day one when I've been practicing. And that's where somewhere my name Synergy also comes in from, because I like to make the patients as their partners in their healthcare. So it is not a one-way street. It has to be a partnership, mutually beneficial partnership with them.
So, sir, like, what were the problem you were trying to solve when you wrote your book, which is Patients as Partners?
Yeah, so see, the patients as partners is my effort, and this book is directed towards the fellow ophthalmologists, or for that matter, any person in practice. So it's basically for the doctors. So my belief is that the good old system of medicine, where the patient referrals were the best way of growing in practice. I have got a very bad marketing segment in my practice. Most of my patients are from word of mouth. But word of mouth is the best way of getting the growth in practice, right? So that's what I say, make their patients your partners. Not only their partners when they understand the disease, they also become your partners because if you give them so much of value, they become fan of yours. And then they are going to ensure that the other patients come to you. And how you become a partner with them is by treating them properly. In today's world, competence is a given. Like there are 4 values that we follow in our place. There is a part of my brand also: competence, integrity, safety, and compassion. So competence is a given in today's world because you cannot be successful if you're not competent. But what is becoming very important is how honest you are with the patients, because patients can understand if you're being honest with them or not. So if you're being honest with the patient and if you're being compassionate with the patients and treat them as if they are a part of your family, the patients will see that. And that is the value that I like to give to every patient. And that converts the patients into a fan. And that is how they will refer more patients to me. So this book is basically to break the myth that many people have that if you're doing honest practice, you're doing some sacrifice. What I'm trying to explain in my book is, by doing an honest practice, you are actually going to make more money. Not only you will sleep better, not only it is better for the society, actually you earn more also. People think यार ये बंदा ईमानदार है तो बंदे ने कोई sacrifice की कम पैसे कमाएगा. But what I'm telling them, and from my 25 years of experience, that by being honest, you can actually earn more money, you can get more patients, you can get more referrals, and you will grow much better. And this growth is more permanent because there the patients are not coming from your social media and all those kind of activities. The person coming to you through the social media is very frivolous kind of a patient. He will come to you today, tomorrow he'll go to somewhere else.
Right.
But someone who's coming to you with a referral, who's seeing value in you, will stick with you. So there is one very interesting statement in that book that I have written and that I follow, is that you have not yet arrived if you give a patient 6x6 vision and he comes back to you. वो तो patient आपके पास आएगा ही आएगा. But you have really arrived when a patient goes blind in your hands and still he comes back to you for his other eye or for his relatives. Because it is not the results which are important. It is your efforts which are important. Because I deal with retina patients and these are complicated cases. So I cannot say that 100% of my patients become all right. There's a significant failure rate in a retina surgery. But almost all the patients who have had bad results with me, because of the kind of disease that they have, and sometimes, of course, we all make mistakes also. So I'm sure there's sometimes that we all doctors and surgeons have made some mistakes, which in retrospect we feel, yeah, we actually messed it up there. It is human. But if you own up the mistake or if you own up the problems that are there and say, okay, now I'm with you. And if the patient can see that value, then he would develop the trust in you. And often these patients who have had a bad results are bigger fan of yours compared to the patients who have had good results. Because the patient who had bad results, you get more time to interact with that patient. You have had more post-op visits with him. So he can see your real worth, right? So these are the patients who are the biggest fans of mine, who will refer me more patients. I'm not saying that you should create more complications and have more of such patients. Of course not. But even if you have a complication, don't give up on those patients. Don't run away from the patients, rather run towards the patients. Go to the patient, hold their hands, be honest with them. Tell them that you had a problem. Tell them that you managed it well, and tell them you are there with them. Do not promise them the results, but promise them your efforts. And patients also know that you are not God. Patients also know that you are human. They are looking at your efforts and your results. So I think that is one learning that I've had in my life, that a few of my patients, and I'm really indebted to them, that they had bad results with me and they stood by with me. And fortunately, when we operated on the other eye or their relatives, they all went on okay. But that trust that they have shown in me, I really feel a lot of gratitude towards them.
So, sir, in creating that trust, sir, what is the mistake a young surgeon makes?
The mistake that the young surgeon makes are a few, which I've covered in my book. Often when you get very good results, in ophthalmology, we normally get 99% patients to excellent. So we somewhere start to feel that I'm infallible, I'm God. And somewhere that thing comes to the mind that if you get a bad result, that is a mistake of yours. So God forbid, whenever there's a complication happens, or even if there's not a complication, if because of the patient's retina condition or something or the other, the patient gets a poorer result than what you expected it to be, you start to feel guilty. And then you start to hide the fact from the patient. You try to say, nahi, sab kuch theek ho jayega. You are kind of start lying to the patients. And that's where the trust breaks. So not only you unnecessarily put that guilt on yourself, you also do something which is legally also wrong of lying to the patient and hiding the complication, which can land into a legal trouble, which breaks the trust, and the patients think that you have spoiled the eyes. So you have to, first of all, believe that you are not God. You have to do the best, and the results are in the patient's hands, in the God's hand, and so many other variables are there in that. Second, if you have a complication, don't run away from it. Own up the complication. I rather say that you should take the credit for managing the complication. Because creating a complication, everyone does. You're not a good surgeon if you can do a good surgery, right? You are a good surgeon if you can manage a complication well. Because that is where the real जो आपका जो मुद्दा होता है वहाँ पे दिखाई देता है. Yes, if I have a complication, if I can maintain my cool and still manage that complication, that is when I've arrived. So you should do that, and you should take credit for managing that complication. Because by doing that and telling the patient that, the patient also understands that this guy is honest and he'll stay with you, right? The best time to tell the complication to the patient is immediately after the surgery. Don't hide it. Because if you hide it, then you're losing the trust and you're also doing something which is illegal. So that is important. And other thing that often the people make mistake is that when you get a good results, you take the credit for it. And when the results are not good, you kind of say, "Ya, tumhari takdeer kharab thi, tumne ye galti ki, Bhagwan ne kiya," whatever. So I'm very clear about that. I do my job. If a patient gets good results, I still don't take credit for it. I say, "Boss, I did my job well. It is your luck. It is our combined luck which is working. So I don't deserve that extra credit. Fine. I'm the medium through which this has happened to you." Same way, if I get a bad result, I again don't take the blame for it. So you have to be equal in both the sides. Don't take the credit, don't take the blame. Take the credit for your efforts, but results are not in my hands. I can prognosticate, I can tell you कि क्या expect कर रहा हूँ, but ultimate results depends upon the combined luck and so many other factors that are there.
Right.
And if you follow that consistently, then the patients also understand, okay, this guy, because when the patients are there, they listen to how you're talking to the other people also. So even if in front of him you have not taken the credit, but he has heard it somewhere that this guy is not taking the credit. So if you have something wrong also, then he would understand that this guy is kind of doing his job. And it has to be a culture across the organization. So that helps.
So, sir, as you said, if it is a good surgery, don't take the credit. If it's a bad surgery, you don't have to take the blame. So, when you are doing the surgery, you must have facing complications. Sir, what mental framework you use so you can manage that complication well?
Yeah. So when I say don't take the blame for the bad results, that doesn't mean don't take the responsibility. Blame and responsibility is different. I'm responsible for it and I'm responsible to correct it. But I'm not guilty. So that is very, very fine dividing line there. And once you have this thought process in mind, when I'm operating and I have a complication, if I know that I'm not going to take the blame for it, the fear factor goes away, right? Otherwise, the moment you have a complication, you start to think, how the hell am I going to save myself, right? So then you're operating from that sense of fear. Then you may not do exactly what is right for the patient at that time because you're operating from that fear mindset, right? But when that fear mindset is not there, when you're only responsible towards the patient, then you will do whatever is best for the patient. You have to maintain your cool. Of course, that takes time. With experience, you learn to maintain the cool because, as I said, that the real way to judge a surgeon is that how he manages the complications. So you have to maintain your cool. Don't add that extra pressure of guilt onto yourself. Don't add that extra pressure, that I'm going to be taken to the court or I'm going to do something is happening. Because the moment those things come to you, become very defensive, right? So you do whatever is best for the patient. And one very important thing which I tell my juniors is that sometimes the perfection is the enemy of good. So if you have a complication, you should know when to stop. Sometimes to achieve perfect result, we end up creating a mess. So you have to know what you're doing, at what stage you should stop, and not let your ego take over and say, no, I'm still going to do the best possible job. So you have to somewhere decide when to stop also. Because often the complications, the major ones happen when you're trying to achieve that last 5% of the perfection. So if the case is having a problem, then you kind of decide when to stop. So if I'm doing a retina surgery, if I know there's a peripheral traction that is there which is not going to bother the patient, but I want to give him a perfect retina just for satisfying my ego, the patient is not going to benefit by that. And in trying to achieve that, I may end up creating a complication. So it is important to know when to stop. So that again comes with experience also, but I think that is one thing that we have to learn.
So you have talked about synergy model also in your book. So if you had to explain it to the young intern, so what that model is?
So in my journey in a practice, 2001 I started my practice in a partnership with another friend of mine. For 15 years we were together. So there was two people owning the practice. After that we had a separation, and since 2016 it's a single owner model and multiple users model. So first of all, it's a group practice model. The way the things are happening, individual practices are going down because the amount of infrastructure required, the logistics required, the compliances that they have to maintain, for a single doctor to maintain all that is becoming difficult. Now, group practice is the way to go. Now, there are two ways of group practice. One is that where multiple people invest their money, the multiple owners model, which I had for 15 years. Other model that I am working is a single owner and multiple users model. So in the current model, I am the owner of the whole place. I have the full-fledged systems in place, all the compliances, all the insurances, panels and everything. The best of infrastructure is there. But if I just invest all that money only for my practice, I may not be able to take the ROI on that part that easily. So what I have done, I have opened it up for other doctors to come and use the facility. So there are other doctors who are coming as visiting consultants. They are not my employees. They are coming on a shared services basis. They run their OPDs from my place. They use my facilities for the investigations and procedures, my operation theaters. So they get the benefit of getting everything in one roof. And they get the best of equipments, which is updated on a regular basis. They don't have to bother about the salaries of the employees. They don't have to bother about the compliances, about the panels, NABH and all those things. So for them, it's a win-win because they get into a very well established center where they operate. They have to share some revenues with me. But on the whole, if they were running their own centers, compared to that, they possibly are earning more without any hassles of the management. So for them, it's a win-win situation. For me, I have to anyway set up that kind of a place for my own practice. So when they come in, the same equipment, the same OT is being used more. So therefore, my ROI becomes better. And the other advantage is because there's a bigger team, like we have about 25 doctors right now as visiting. So there's a lot of cross-reference that will happen. So someone is say I'm a retina specialist, someone is a squint specialist, someone is a glaucoma specialist. So if we have a patient with that, we will refer to each other within the same umbrella. So the patient also becomes very easy for him to stay in the same premises. We also refer to each other. That helps each other to grow their practices. So it's a mutually win-win scenario for everyone. Now, what is important for running this thing is that there should be trust between the various partners. They should have trust in me that when their patients come to me, I'm not going to poach up upon their patients and tell them, you come and show directly to me. So that kind of a trust has to be there. And that is one thing that we have offered to them. And the best part is that the doctors who are already there with us, they are the ones who get their friends to join our system. So this model has been working very well for the past 9 years with me. And it's a mutually win-win situation. And I think that is the future of practice. So,
Sir, what I have thought is ki, like it is replacing competition with collaboration.
yeah. See, there is enough work for all of us. There's no need of competing. Say, for example, if someone's patient comes to my clinic and my staff tells him, "Kya tum directly mere paas kyun nahi aa jate, unke through kyun aa rahe ho?" I may take one patient from there. I may get a bit extra earning from there, but then I'm going to lose him. And whatever revenues that we were getting, whatever goodwill. So in fact, today what I tell people is that I'm actually monetizing my honesty, whether it comes to the doctors or whether it comes to the patients. Like for the patients, as I said, it's a basically trust-based practice that we are talking about. With the doctors also, because they know that here we are doing ethical treatment, so they are also comfortable here. Of course, everyone who is a part of the team has to have a similar kind of an ethical background. Not exactly same, but similar. Therefore, we defined our 4 core values as a part of our brand itself. So we know, we have written it out there that these are the 4 values that we are going to be following. If we find someone who joins in who's not really gelling into this ethical system, he anyway slowly gets weaned out because he won't feel comfortable here, and somewhere we will also not be comfortable with him. So the team that we have, we follow the same kind of values, and therefore we're very comfortable dealing with each other. So this tribe is growing, so this is working quite well.
Sir, as per from Indian perspective, sir, what is the challenge Indian doctors are facing right now, which public rarely understands?
The multiple challenges. One is, of course, there's a awareness is there in the society. So everyone knows what the latest techniques are. And they, of course, expect the best of the results, best of the treatments to be offered to them. Unfortunately, the payment modules are still not keeping up with it because there's so much of newer equipment, they come with a lot of cost. There's a lot of consumables costs that are there. The kind of system that we need to develop, we need a lot of manpower also. So the older times, we could do away with the lesser manpower, not that great machines, and we were still producing results. Now, of course, we have doing the world-class technology to the patients. But the payment structure somehow still, the patients and the society is not geared up to pay. One, because, of course, there's an income disparity that is there, and second, also because the mindset is also not there. So sometimes that mismatch does happen. So that is one challenge that we have. Second is that per se, the practice module, the private practice module in the society is not as developed as the Western system. It is going there now, like the group practice I talked about. These kind of concepts are very well established outside. These models are coming in now. And then third, there's a lot of insurance penetration and all that is coming in with its own challenges as well, because right now the insurance companies are kind of pushing us. They are trying to bully us a bit. So I think those systems are still getting organized. Of course, for the poorer patients, we need to be more reasonable to them and do it at a low cost. But sometimes those costs that the government is giving is not very viable. Right? If you're doing a huge volume surgeries in that tier 2, tier 3 cities, it may still be viable. But when you're talking about tier 1 cities where everything is expensive, to give those kind of services, and we don't want to compromise on the quality of services, to do that at the kind of money that the government offers is difficult. We often cross-subsidize from our more paying patients to make our running of the hospital. But as more and more people go onto those schemes, the viability of the systems might be a problem there. So somewhere the government has to think about what are the required norms that are there. Some of the requirements that they have from us are very archaic. For example, for ophthalmology, the expectations to keep nursing staff, to keep all the setup for overnight stay and all those things, which are not required in our field. But because our nursing home rules and the ophthalmology rules are very similar, So we need to have separate rules for ophthalmology and the other daycare services so that the compliances and the challenges of compliances are lesser on us. So we can focus more towards caring for the patient. The number of compliances that are required is a bit too much. So that is a challenge for the ophthalmologist. Sometimes I use it as my opportunity as well because the compliances are so difficult. Therefore, not everyone can manage that. Therefore, many of those doctors are coming to me and they're benefiting from the synergy model. But though I'm benefiting from those compliances requirements, but I would not like that to be there. I would like that to become simpler. The ease of business, the way it is being done for the other things, it should be done for medical practice also. The government is working towards that. The things are being streamlined. So we are hopeful. And of course, everything takes time, so it will take some more time to do that.
So, sir, if you had a power to change, to fix one thing in Indian healthcare system, what would be that first thing?
I would, I've in fact given a suggestion also to the PMO. Let's see if they work on it. But I would like the government to use the technology better to help educate the patients about their health situations. So there are two ideas that I have floated, I think, and that's very easily doable things. One is regarding eye donation, right? So my idea is that the government should link up all the eye donations to the Aadhaar card or whatever medical ID of the patient. So whenever a patient dies in a hospital, at that time the Aadhaar card data is also there with them. So the information flashes that, okay, this guy is an organ donor. Often what happens that I may have pledged my eyes or my organs. When I die, my relatives won't remember about it. So even though I wanted to donate, the thing just goes waste. No one has remembered that. Whereas if this information is tagged to my Aadhaar card or whatever medical ID that is there, in the hospital, that thing flashes that, okay, this guy is an organ donor. Then the counselor, when they go to the family and says that, okay, your father wanted to donate his eyes, his organs, or the other things, the chances of conversions are better. And make the whole thing much simpler. Simple, just send a WhatsApp message or a SMS to every person saying that, do you want to be an organ donor or not? The person just clicks yes or no, and that happens. So just make it very simple. Of course, Sri Lanka has a system of presumed donor. So till you say that you are not a donor, you presume that you are agreeing to be a donor. That can be another way, but okay, fine. If you don't want to do that, at least make it very easy. Other thing I suggested was that the way we have got an Ola and Uber app where you press the button and the location gets shared, let's create an app or a website. So if someone dies in the family, they just click on that button, the nearest eye bank or the organ banks are notified, they get the location and they connect with you and they can come to you. So rather than someone searching at that time ki nearest eye bank kahan pe hai, how to connect with them, make it simpler so that they can be more voluntarily involved with this thing. The second idea is about diabetes, because diabetes and diabetic retinopathy is a very common problem. And being a retina surgeon, I see lots of diabetics who are not aware about the fact that they have to do a regular checkup of their eyes, and they come to us very late. So one is, of course, all the physicians have to educate their patients. That is one thing. But what if we create a diabetes register or something that anyone who's diagnosed with diabetes, the database goes to the centralized register. Now, from there, there's a regular SMSs or literature being sent to the patient on WhatsApp or SMS about what they should do. They should take care of their eyes, their kidneys, their heart, their feet, so many things that are there. So have a system where that kind of a thing is centralized and done through the government if individual practitioners are not able to do that, because not everyone can have that kind of systems in place. So if we create a registry where we start to educate patients based on that, so that will go in a long way to prevent the morbidities happening because of these serious diseases like diabetes or blood pressure or the other things. So government should start to educate patients onto these things. And that's one thing that is my idea, that I would like to use the technology. We have all the databases and we are great at technology, our Aadhaar system, our UPI system, our COVID vaccine certification, everything we have shown that we can work with the large data. So why don't we use that kind of a thing to educate our patients, especially for the chronic diseases?
Sir, if we look out at Indian context, sir, where do you see ophthalmology or healthcare is evolving within next 5 to 10 years combining with AI?
So, ophthalmology, especially in India, is growing great guns. I mean, the best of the surgeons in the world come from India. The quality of surgery, the precision of surgery that we are giving is great. AI, it so happens in AI in medicine started with ophthalmology, started with the retina only. Because the first studies on AI was done with diabetic retinopathy detection. That's what the Google did the study on. So anything which is visual is likely to benefit most with the AI. So that comes retina and radiology are the two factors where it's helping maximum. So AI is already helping us. AI for picking up the diseases early is going to be useful. AI has to be used along with the surgeons or along with the doctors to make the doctor's time more productive and more effective. So AI is not a competition to us. AI is a tool for us which should be used in that manner. But however advanced the AI may become, the personal touch that is required, the trust that is required, maybe surgical precision part will be taken care by robotics in the future. But the personal touch and the trust and the human element that is required. And still the decision making, keeping the patient's emotions in mind, patient's requirements in mind, that still I think the AI would find it difficult to handle. So those are going to be the features where they're going to be very, very important, where the doctors will be involved. So somewhere humanity part has to be added into our practice in a much bigger way. And that is one thing more about your question about what the government should do. I think in our medical education system, there's so much of studies that we have to do for everything. But the skills of clinical practice, that psychological aspect of dealing with a fellow human being, some bit of financial aspects also, how to deal with your own life, how to deal with your investments, how to invest in a clinic. I mean, those things are important to be taught. Because if those things are not taught, when the person comes out in practice, he kind of feels that the only way to earn money is by doing unethical practice. And that is where a person who is an idealistic guy who comes out from the college suddenly finds himself into a very, very bad world of practice. And my book is also an effort towards trying to educate them. But if we can put some of this psychology education, human behavior education, dealing with patients, soft skills, financial, these are very important parts because medicine is not going to be only science-based kind of a practice. And with AI coming in, a lot of information we keep mugging will become less important. It is how you apply those sciences and how you deal with a fellow human being. Those are going to become more important. So it's time that we start focusing more towards that and less towards the rote learning part. So I think that is one thing we should be working towards.
So now I want to ask a question about your life, not as a doctor, but according to you as a person. What is a meaningful life?
See, a meaningful life, to be honest, the first priority of life is to survive, right? So, survival taken care of, then you start to look at the meanings of life. So, when I came into practice and everything, first thing was to establish myself, to get that recognition that yes, I am worth what I am, and to earn reasonable amount of money to take care of my basic needs. After that, the meaning comes in. So now, fortunately, we are at a stage that I've established myself financially, I'm secured. So the real meaning for me, and that can be different for different people. For me, the meaningful life is that I'm very fortunate to be in a profession where I can easily create a difference in the people's lives. Like, as I said, I come from a business family. My father was, along with business, would do a bit of social work. So he would have to go out of his house, go do some work to really be helpful to the society. We are very fortunate कि हम अपने clinic में बैठ करके we can still serve the society the way we want to, right? So I can give good quality treatment to the patients, genuine treatment to the patient. That's a service. Even if I'm charging, that's still a service. I can do free surgeries for the patients who are required, which I do, and I feel very strongly that charity is an option. It's not should not be pushed upon me. If you tell me that you have to do charity, I would resist it. But if I want to do charity, I will do it, which I will do. So we are at a fortunate position where we can help out people. And Another philosophy of mine is that if I'm doing a charity, I don't want to call it a charity, if I'm helping someone, I don't expect a thank you from that person because I'm not doing that person any favor. My philosophy is if I am doing something good, I feel good about it, right? And that is my reward, that is my remuneration. Today, if I have a lot of money, what do I spend it for? I spend it for something where I feel good about it, right? So we are spending money to feel good. We are doing all kind of funny activities where we are even harming our health just to feel good. So if you can feel good by doing good, so you're getting more than what you did, no? So you got your rewards immediately. The moment this realization comes to you, the ego melts away. Then I don't feel that I'm doing some favor to someone. Actually, that guy is doing a favor to me by letting me do something good so that I can feel good about it. So for me, it's very simple. You are not doing favor to anyone. I'm doing it because I want to do it, because I feel good about doing it. So we are at a place where we can do a lot of good and feel good about our profession. So I think we are very, very fortunate about that part.
So how do you define success?
Again, I will come back to that. The first step of success is survival. So once you've survived, that's one level of success, right? So now you're not dependent on someone else to survive. After that, if you are happy, you're successful. Very simple definition.
It's just in one line. Like if you are happy, you are successful.
Because you may earn billions of dollars and still not be happy. And you may earn just enough to survive, and if you're happy, you're happy. And ultimately, the money also is earned to get happiness. So if you're able to get that happiness, you're happy. But that all comes after survival is taken care of. So you cannot get all philosophical till you have got food on your plate, a house to live. So those basic necessities are a must. We are not yet evolved that we can go and stay in a cave and be happy there. Yeah, I mean they are also successful. But for lesser mortals like us, once you're taking care of basic needs, and then if you're happy, then you're happy.
So sir, if I close this podcast with this question, like what advice you would give to young doctors who are choosing medicine as their career choice, what that advice would be?
See, my daughter chose medicine, and I made it very clear to her that don't come to medicine thinking that it's here I'll make a lot of money and this and that. Medicine is not an easy path to take. It requires a lot of time, a lot of effort, a lot of hard work. If you can't do that, don't come here. Don't crib about the hard work that you're supposed to do, because that's a part of life. You've chosen this thing. But if you're really passionate about this, then it's the best field that you can come to. Many of my colleagues will keep cribbing, ye hai, wo hai. Come on, yaar, you came to medicine because you wanted to do it, right? So you can't crib about it. Yes, you can think about how you can make it better, but cribbing would not make anything better. But this is one of the best professions, like I said. There's an option of doing something for the society. You can be independent. The respect is there. Of course, it is not the blind respect that we used to have, unfortunately, but we are also responsible to a large extent. And also the consumeristic society is also responsible. Whatever is there, right? But still, it is a reasonably well-respected field. And there's so much of potential for you to help and be happy about that. So come to medicine if you're passionate about it. And don't get distracted by the people who keep cribbing about it. It is one of the best fields that you can think of. So if you love interacting with patients, if you love interacting with human beings, this is the field for you.
Sir, it's more like now when you choose a profession, there are positive aspects to it and negative aspects to it. You have to choose both of them to work effectively.
So you should know that medicine is not an easy path. So if you're aware and you're choosing it, then you should have no reason to crib about it. A soldier who goes out on the field, at the battlefield, he has got no right to crib about the risks to his life because he chose it. Our gratitude is there towards the soldier. I'm not underplaying that. But he should not crib about it, right? He knew that this is a part of his job. The same way we have chosen, we know this is a part of our job, so there's no reason for me to crib. I would love the society to have the gratitude towards the profession and that respect that they give to the profession. That should be there. But I cannot demand it. I'm doing it because I want to do it. I'm not doing anyone a favor by coming into medicine. There are so many other people who are willing to take my seat. So I'm not doing anyone a favor. So you don't demand the respect from the society. Be happy that the society is giving the respect. So I'll just, every profession is important for that matter. I mean, the life teaches you from all funny kind of places. So one of the incidents that happened with me, which I've written on my book also, that I like adventure sports. So I went to Hong Kong for a conference. Then there I went to Macau, and there I had half a day free. मैंने कहा चलो bungee jumping करते हैं. The first time for me, I went to Macau, and that's the world's highest tower. I went up there for bungee jumping. I was alone, right? And just before I take that plunge, I just realized that, this guy whom I don't even know, this guy has put all the harnesses on me, and I'm taking a leap of faith,
Right.
right? And I don't know what's going to happen to me. And I trusted my life to that guy. And that's when I realized that the patients also, we make them sign the consents and all that thing, but that means nothing. That guy is trusting his life, he's trusting his eyes to you, and he's taken that leap of faith. So that's where I realized that, we are so responsible, we have got so much of responsibility on us. We have to live to that faith of the patient. We may still fail, that's a different thing. But that patient is trusting his eyes to you. And that's the biggest trust that anyone can give to you. So we have to be worthy of living up to that trust. So sometimes some interesting fun activities can also give so much of realization in life, I think. And that was a big realization for me, that, we cannot take our position very lightly. So just something that I picked up somewhere.
So thank you so much to be on this podcast. It was a wonderful conversation with you.
Thanks a lot. I think it was a pleasure talking to you. And honestly speaking, you know what? While I was talking to you, a lot of things were opening up in my mind also. Some things that I had never thought about, that opened up in my mind. So it helps to converse about things. So some things have opened up for me also, which is great for me. So thanks for giving me this opportunity, and
Thank you so
wish
much, sir.
your viewers all the best in their life.
Thank you so much,
Thank you.
sir.